Is there anyone here who doesn't see something in the world around them that they want to change? For whom the world around them is perfect? No? Indeed, it would take a brave person to concur. It's part of what makes us inherently human, that desire to improve things. It's that answer to the question of what's the purpose of life, to leave the world a little bit better than we found it. Now today, I was originally slated to give a talk about health equity, health policy, and how we can build health systems. But as I was writing, rehearsing, researching that speech, I realized that there was a more personal story that I wanted to tell. That's the story of the Vaccine Project, the charity I founded in 2020 with a group of friends. It's the kind of story that I hope I would want to hear. It's the story of how a bunch of university students can see a problem and try and do something about it. It's the kind of story that I hope that you take away thinking, I can too. In 2020, I was your friendly neighbourhood medical student, going about my days, learning, trying to work out whether or not the funny bone was actually a real bone. But that all quickly changed when I came across a press release from the South Australian government that for the first time in South Australia, people experiencing homelessness would be able to access a flu vaccine for free for the 2020 flu season. I was taken aback by this. Did that mean that previously this highly vulnerable group, who were most at risk of catching the flu and also most at risk of getting severe complications of the disease, weren't able to easily access the best preventative measure we have? If this was previously the case in South Australia, how about in Queensland? A quick Google showed me that it was the same. Unless they fell into another high-risk group, such as being over 65 or having a severe medical comorbidity, people experiencing homelessness weren't automatically eligible for a free flu vaccine. They had to hope that a medical service would cover that cost or shell out of their own pocket to purchase the vaccine. For me, this is a problem that seemed so simple. It had such a clear solution. For the next few days, it bounced around inside my head. Surely there was someone else doing something about it. Maybe this wasn't even something that people out in the community actually faced. I needed some help at this stage to try and answer those questions. So I got a group of my friends, 6 of us, Jack, Pele, Mike, Lily, Varun and Hannah, into one of our living rooms. And over some nachos, I shared what I'd found. These were friends who had the same passions as me. They were people who could cover my blind spots, whose strengths were my weaknesses. Together, we resolved to try and do something about this. But first, we needed to work out if it was even a problem at all. We went about that the only way we could think of, literally cold calling the largest homeless health service in Brisbane and asking them. After some initial confusion, which in hindsight was very well justified from their part, we heard what we feared, that for many of their patients, they couldn't access the flu vaccine. This is a cost that the clinic couldn't cover, and in 2021, they'd resigned themselves to the fact that they wouldn't be able to help their patients prevent themselves from getting the flu. So we got into action. We scoured the internet for every not-for-profit legal resource we could find and established ourselves as a charity, the Vaccine Project. We hounded family and friends. We ran fundraisers, and eventually we raised the $2,000 that we needed to purchase the flu vaccines on the behalf of this charity. In this process, another local charity, helping young people experiencing vulnerability, reached out. Their patients too faced this same problem. Luckily, given the success of this fundraising, we were able to support them too. And by July of 2021, I must admit, we were pretty proud of ourselves. We'd supported 2 charities, more than the one we'd set out to. And for us, the solution was in sight. It would be easy. We'd just lobby the state government to follow South Australia's lead, and that would be that. The problem solved, our job would be done. Of course, given the fact that I'm speaking here today, you might have guessed that that wasn't it. Indeed, in August, one of the charities reached out. The COVID-19 vaccine rollout was just starting, and they weren't registered to be able to deliver vaccines. Their question to us: could we run a pop-up outreach COVID-19 vaccination clinic to help their patients? Behind closed doors, the answer was pretty much no. We were completely unqualified, a bunch of university students. We could barely even get a vaccine ourselves, let alone organise a clinic to deliver them. But when we sat down, we thought, this charity has nowhere else to turn. We might as well try. We got in contact with 10, 20, 30 doctors across Brisbane, all of which politely declined, until we found one who was happy to give this crazy idea a go. The next 2 weeks we spent dotting the I's and crossing the T's, making sure everything was in place, the logistics, and ensuring that the clinic would be safe. 2 weeks later, we ran that clinic, and 22 people received their first COVID-19 vaccine. Another fortnight later, we ran another clinic, where 30 people received their first dose of the COVID-19 vaccine. These were people who didn't have a regular GP. These were people who, if not for these clinics, may not have been able to access a vaccine for many months. At the start of all this, I naively thought that cost and removing that barrier would be the panacea to improving access to healthcare. If we could make it free, then suddenly people would just go about and get the care they needed. Talking to people at this clinic, I realised that that just simply wasn't the case. There were all of these other hidden barriers: time, distance, trust. If we were going to do something about this problem, we needed to take the flu and COVID vaccination clinics outside of traditional medical settings. We needed to take them to where people were, alongside services that had already built up trust with these people. So that's what we did. We needed to take these clinics, not just in Brisbane, but to rural areas where the problem was the same. Over the past year, we've run over 70 flu and COVID vaccination clinics and delivered more than 750 COVID and flu vaccines. But more importantly, I think our volunteers have spent more than 10,000 minutes chatting to people, whether or not they be getting a vaccine through the clinic, about their health and about their lives more generally. Amidst all of this, that original idea to get the Queensland government on board to support a pilot program like that in South Australia was realised. This year, they committed to helping 10 charities, including ours, access completely free flu vaccines for the people that they supported. So that's where we are today, but the question then lies, what next? For our founding team, the progression was natural. We've realised that now that we have this momentum, we might try to do something a little bit more. We've tried to address one problem, but in doing so, we found many more. And so we're going to start running regular, weekly health clinics, comprehensively, including doctors, pharmacists, pathology. The first of these was just launched in Spring Hill, and 2 more in East Brisbane and Toowoomba are launching in the coming weeks. For me, this was the realisation that when we had this momentum, when we had the experience that we've gained from almost stumbling from one area to another, we might as well try and capitalise on that now, to take what we've got and run with it. This hopefully will be the way that the vaccine project can help more people in more innovative ways, in more places. That's what will happen next. But for today, I hope that this story of where we've come from to where we are is something that can make you think. This is a story that's been punctuated by luck as much as hard work at times. But hopefully it gives you the experience and the inspiration to think, if this bunch of unqualified university students can do something about a small problem they see, maybe I can too. When you see that problem in the world, just start by taking that small step. You'll find the people along the way, and the path will open up in front of you. If we can do what we've set out to do, I think ultimately all of you can too. All of you can be the change that you want to see. And ultimately, all of you can leave the world a little bit better than you found it.